For our crown and bridge delivery tray setup, we're going to start out with a mouth mirror right here, which allows indirect vision by the dentist and reflects light onto surfaces. Then we have our explorer to examine teeth for the presence of cavities. And then we have the probe, which is used to measure the pocket depths around each tooth. And then the spoon, which is used to remove carious dentin and check for solid enamel walls. And then we have the cotton pliers, which is used to grasp or transfer items or materials in and out of the oral cavity. And then the condenser, which is used to pack and condense into interproximal areas of cavity preparation. They also come in different sizes. Then the Woodson, which is used as a burnisher and a condenser. And we have our cotton tip here, which is used for the topical. It is put on before using the aspirating syringe to numb the specific area. And then we have the hemostat, which is used to grasp tissue or bone fragments, but for this tray setup, we use it to remove the temporary crown. Then we have our air water tips, which are used to rinse and dry specific teeth or the entire oral cavity. And then we have the HVE tip, which is used to keep the area free of debris and can be used to suck up saliva to keep the area dry. And the saliva ejector does the same thing. We have our cement over here, which is the Fuji. It is a glass ionomer eluting cement that chemically bonds the tooth structure in metal. And then we have the shade guide up here, which is used to pick the shade of the tooth before placing the before placing the crown. And then the burr block over here is used to hold the burrs in place. And then we have the articulating paper and the holder. The holder just holds the articulating paper, and the articulating paper checks and highlights the occlusal contacts. And then we have the topical gel here, and the wooden bite stick, which is used to seat the crown in place. And then the 2x2 gauze and cotton rolls are used for retraction and to wipe areas clean. And the anesthetic aspirating syringe to administer a local anesthetic. And we have the metal crown and the mixing pad to mix the cement together to create the material needed for the prep. And that is everything for a crown and bridge delivery tray setup.